If you're suffering from hair loss and you're a male between 14 to 64 years of age, then this video is for you, because by the end of this talk, you'll be able to find out as many possible treatment options for your hair loss as possible. If this video has popped up in your feed or you have searched for it, it means you are worried about your hair loss. You may or you may not have visited your hair doctor yet. Well, today I have come in front of you to discuss why you are having this hair loss, what are the different reasons you are having, what are the various symptoms you may be feeling along with the hair loss, so that you are able to diagnose before even going to the doctor the different causes of your hair loss, and then what are the possible treatment options available for you at present times in order to regain some of the hair or to better your hair at any point of time. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon. You can subscribe to this channel. To alleviate your anxiety and confusion about hair loss, before step by step discussing the causes and the treatments available, let me help you with some nutrients which can help you for hair fall so that you start feeling positive about it. Let us discuss some of the lifestyle and diet managements which you can do, of course, with consultation with your doctor. So it has been researched that a few micronutrients and elements like gamma-linolenic acid, then copper, zinc, iron, vitamin D3, all these are very important for hair growth, especially for the stem cells present in the hair root. But thankfully, we have multivitamins present nowadays in the market which you can take after your doctor says so, and then it will help you in alleviating the hair loss problem. These multivitamins will be given to you either in the cyclical fashion or they can be given together as the doctor decides for you for a limited period of time. Because if we do the investigation for deficiency first, then I should tell you that researches have been done that if my body is deficient in some micronutrient, then in order to better it, in order to raise the level, sometimes body adopts its own mechanism, like it can do autophagy, like a few cells may be destroyed so that some of the nutrients are elevated. So if this happens, the investigation will not help me. Therefore, clinically, if my hair is falling, it's a chance for me to have the multivitamin and regrow or better my hair. Of course, the importance of nutrients, balanced diet and lifestyle management in the form of some exercises, walking, yoga cannot be overemphasized. This has to be done in a proper way. If you're liking it till now, please press the like button, and then let's move to the causes of hair loss. In males, the most important cause, the most common cause is male pattern baldness. So you see people having the M-shaped pattern, the hair going from the temples or hair thinning in between or in the crown. This is the commonest pattern of hair loss, and this is male pattern baldness. Usually it is hereditary, that means it runs in families, but you may be the first person in your family having this hair loss. So it may start from you. It will now pass on to your progeny. Sometimes it is atavistic, like the grandfather has it, the father has normal, beautiful, lustrous hair, and then the grandson will have it. This is atavistic character. This may be there in your family. So this male pattern baldness is usually polygenic, but the most important gene is androgen receptor gene, which is the AR gene. If this happens, there is DHT in your body, which is present in every other male, but what this will do to you, it will go and attach to the root of the hair. So now the shaft of the hair will keep on thinning, which is called miniaturization. The anagen phase, which is the growing phase, will be shortened. It will keep on falling early, as much as you may lose the whole follicle as it is. So yellow follicle may be visible when we do the dermoscopy. So this is one type which is commonest, male pattern baldness. Secondly, you can have, as we suggested a little while ago, nutrient problems, nutritional deficiencies. Thirdly, you can have alopecia areata, which is autoimmune disorder. You will have circular patches of hair. In fact, they will just go away. Sometimes it may grow to bigger sizes, and sometimes you will regain hair without doing anything. So in these patterns, the follicle is preserved. There is no fibrosis. You may have little itching or little flakiness, but then the major problem is hair loss only. In the other problems, which can be like fibrosing alopecias like pseudopelade, then LLP, then FFA, so many hairs attached together with flaking, itchiness, redness, sometimes pustules. If these are the problems with you, you need to consult the doctor, because you may be suffering from some of the alopecias where you need a medical person to help you. If you have any such problem, do write in the the comment section below so that we can help you. Coming on to the various treatment options available for you. So we have divided this into 3 parts: medical treatment, therapies available, then hair transplantation, and along with that we will discuss the scalp micropigmentation. Coming to the medical treatment first. So US FDA has approved topical minoxidil and oral finasteride as FDA approved medication for male pattern baldness, which is androgenetic alopecia. Nowadays, minoxidil is available orally also and finasteride is available topically also. In the consultation, along with the trichoscopy, maybe he decides something what to give and how to give. Along with that, as we discussed multivitamins a little while ago, multivitamins should be given for hair loss, especially male pattern baldness. And now, because male pattern baldness is the commonest cause of hair loss in men, the treatments we are talking about are for male pattern baldness. So minoxidil, finasteride and multivitamins, these are the 3 things which are given for you to be used daily for the treatment of male pattern baldness. Besides, you need to keep your scalp clean, shampoo as per your routine so that you do not feel the itchiness or oiliness or things like that, and you start feeling positive about it. If you want to know more about the multivitamins which you can have, you can click on the video above, the 3 best multivitamins which are needed for your hair. Coming on to the much hyped therapies for hair loss. So in the therapies, we should learn about PRP therapy, mesotherapy, then low-level laser therapy and derma roller. Coming on to the PRP therapy first. PRP stands for platelet-rich plasma. So what is that? We take certain amount of your blood from your vein, we centrifuge it, and there is a proper way of making platelet-rich plasma so that the platelets are multiplied at least 5 times. So there should be more than 1 million per ml. Now this platelet-rich plasma has immense number of growth factors for your hair cells. So this, when injected in the area where you are losing your hair, will help them grow faster and reduction in hair loss. Mesotherapy are the pre-made cocktails of mesoserums available in the market. These are also growth factors. These are not derived from your blood. PRP is derived from your blood, so you cannot have any allergic reaction to it, though allergic reactions are very rare, but they are pre-made and they are synthetic. They are not from your body. Then low-level laser therapy is the photobiomodulation. Researchers suggest that if you give laser therapy in a certain wavelength on your hair root, then it may help regrow hair. So you see, laser has so many effects in your body. You have hair removal laser, you have fractional CO2 laser for acne scars, then you have Q-switch laser for pigmentation. Now this photobiomodulation is also done by laser, which is in a wavelength of about 450 nanometers, and it is given through the helmet or cap. It may be given by hair comb also, though hair comb is not uniform to be given on your head. And then the last thing which I would suggest is derma rollers. Derma rollers are time tested now for, again, we create small minute bits on your scalp so that more and more drug is taken by your scalp or as growth factors and hair can grow better. So if you want to know more about derma rollers, click on the video above so that you get full benefits of the treatment of derma rollers. Again, if you have any more questions on these therapies, you can always call us on the numbers below so that we can help you. Starting with discussion of hair transplant now. Hair transplant is transplanting of the hair from your safe donor area to the bald area, because now we know that the follicles which are gone cannot be grown back by any method other than hair transplantation. The rest of the methods we have discussed yet are to make a little change in the diameter of the hair or to make hair fall less. But if the hair is gone, then it will be grown by hair transplant only. So what we do in hair transplant, hair to be taken from the safe donor area, put in the recipient area. There are different methods for it. To know more about hair transplant, there are so many videos available at our channel which you can always go visit, and step by step you can understand how it is done, who can do it and where you should get it done. So who can do hair transplant? So once you need to get hair transplant done, suppose you have made up your mind, then you need to search for doctors who are fully qualified for it, who have good credentials. So mostly they should be American board certified hair transplant surgeons. They should be member of ISHRS, which is International Society of Hair Restoration Surgeons. Then they should have good credentials, like they should be either dermatologist or they should be plastic surgeon or they should be American board certified. So once you have learned about the credentials, do see the testimonials of patients. The patients who have got their transplant done from that center, do see the testimonials so that you get a clarity about how is the result of that clinic. Again, one very important point is the cost of hair transplant. How much should you pay for the procedure? procedure. Cost is a very topic. Cost depends upon so many factors. So you need to sit and visit this video so that you understand how the cost of hair transplant varies and why it varies, because it has so many factors. We cannot discuss all these factors here. Before winding up this video, one very important tool in the armamentarium of hair transplant surgeons we need to talk about is SMP. SMP is scalp micropigmentation. So what is it? It is the medical tattoo of hair-like dots which are made on the scalp, which give the fullness of hair on the scalp, but it will not give volume to the hair. So SMP is always fruitful for two very special kind of people. One, who have got hair transplant done, but still there is visibility of scalp and they want fuller look. Second, who want a bald look, who are so deficient in the donor area that they now want to sport a buzz cut, a shaven look, so that nobody can say that they do not have hair. You can share in this video to your friends and family who want to know about a complete guide of treatment options available for men in the present scenario. If you want to know more about SMP, click on the video left. And if you want to know more about side effects of hair transplant, click on the video right.